Look at my baby! They're like, get this crazy man off the streets!
Notice, but lately I've been drifting aimlessly.
Audio Jungle.
Live here at Cebu City, 24 News.
Good afternoon, everyone. It's October 18, 2021, 2 p.m. and this is Vaccinated News. For today's headlines, a 5-year-old Cebuano dog is now arrested and put on a 14-day hold. He's now very anxious and calling on his lawyers to get him out of jail.
Hello, nananawagan po ako sa mga kamag-anak ko dyan na ilalabas niyo po ako sa kulungan na ito. Shoota, hindi ko naman sinasadya mabait yung bata, diba? Kasi hinila niya ako, tapos nasyukes ako. Sus, promise, magpakabait na ako pagkatapos nito. Ano ba? Labas niyo ko dito.
So in relation to that complaint, we now have here DOH Health Secretary Francisco Duga III who will talk about this topic. So hello sir, good afternoon.
So I understand naman what the complaint is feeling now, no? Pero kasi we have this rabies prevention and control program kasi rabies is regarded as a significant public health problem because most is acutely fatal infection and responsible for the death of 200 to 300 Filipinos actually. So for this program, so our vision for this program is to have a rabies-free Philippines by 2030 and the goal is to end human deaths from dog-mediated rabies by 2027. So this has program components which is the mass dog vaccinations, the pre-exposure prophylaxis, health education and advocacy campaign, the training also on the National Rabies Information System, and also to partner with institutions such as the DOA, DOE, and the ILG.
When we come back, we'll talk about the National Rabies Prevention and Control Program and what really rabies is and the frequently asked questions about this disease, so stay tuned.
Three, two, one.
Arf, arf. Hi there, humans. Today, my human asked me and my friends to give you a report on rabies. Listen up because she will come back later and she will ask you some questions and I hope you understand my lecture so she will give me some treats after. Ruff. So what is rabies? It is a human infection that occurs after we bite humans. I am very sorry for that. I apologize. So at least 1/3 of these deaths occur in children 15 years old and below. And walk with me, this is a mobile lecture. So although it is 100% fatal, it is also 100% preventable. So yay! As long as we get some vaccinations, we can prevent you humans from dying. I am sorry again. So for the incubation period, we have an average of 1 to 3 months and the duration of this incubation period depends on these factors. Woo! Look at this table on the right. Yes, pretty. For the signs and symptoms, the pathognomonic signs and symptoms of rabies is numbness and itchiness at the bite site, and photophobia and hydrophobia. It is divided into 2 stages as we can see here in this table. So there is no effective treatment once the symptoms had set in. So it is important to get the vaccine as soon as possible. Like me, I'm running right now to the nearest ABC or animal bite center and get your rabies immunoglobulin. Okay? So now I am done reporting. Yay, I got some treats. I'm a good boy. So let me pass you to my cousin to talk about what to do first if you get bitten by us. I'm sorry again.
So hi there! I am Leslie Turnueva's dog and shout out to my mom. I hope you're proud and now in television. So what my human did before when I bit her, I'm sorry mom. They washed the exposed skin immediately with soap and water and they run to the nearest doctor. Then that doctor in white coat classified her wound according to the nature, place, date, time, site, and extent of the bite wound. Also the condition of the animal who bit her, which is me. They also asked about my anti-rabies vaccination history.
So hi there humans, I didn't notice you were there. So as the dog was saying, di ba kanina, so the categories of exposure is divided into 3 categories, no? So category 1, 2, and 3 as seen on these tables now. Seen on the right, yes, look at here. And now look to the left. And now look to the right again because category 3 is the most dangerous of them all. If you see spontaneous bleeding, you start the vaccine regimen right away and administer immunoglobulin.
So this is an example of category 1 and I'm just licking the intact skin of my master. So we can just wash the exposed skin immediately with soap and water and no vaccine or immunoglobulin is needed. Although we can give pre-exposure prophylaxis for high-risk person which I'm gonna show now. Ay, day, gikapoy na jud ko, day. Katungdok na yung discuss sa uban topics, day, ha. Matug na jud ko. Good night, kasi pa ko ma.
Hi there, it's another episode of Med Talks with Ying. Today's episode is about the National Rabies Prevention and Control Program. So we're done with the introduction to rabies, so we're gonna skip this topic entirely. So let's review active versus passive immunization. For active immunization, it induces an active immune response in 7 to 10 days after the vaccination. This is through the purified varicella rabies vaccine and the purified chick embryo cell vaccine. For passive with rabies immunoglobulin, this is given in combination with rabies vaccine to provide immediate availability of neutralizing antibodies at the site of exposure. There are 2 types of RIG, the human rabies vaccine and equine. This is prioritized for multiple bites, deep wounds, and immunocompromised patients. Next, we're going to review the vaccination regimen schedule as discussed earlier. For pre-exposure prophylaxis schedule, it is recommended at days 0, 7, 21, and 28. But for immunocompromised individuals, they should receive the full IM regimen. For immunocompetent individuals, only day 21 and 28 is not given. Let's proceed. For health promotion, the celebration of Rabies Awareness Month is during March, and the celebration of the World Rabies Day is every September 28. In the next component of the program, we have the RA 94 and 82, which mandates the need to control and minimize the unwanted stray dogs to eradicate rabies. And the duty of the LGU is to enforce dog impounding activities and field control to eliminate stray dogs. And last, we have responsible pet ownership. This includes registration of all pet dogs, vaccination in the first 3 months of each dog, and the annual booster, the provision of proper care, the containment of dogs for observation during incubation period, and the submission of dog sample for rabies analysis. Thank you for watching today's episode.